So I've told you so far the symptoms, important symptoms, regardless of whether it's New Year's Eve or whether it's Christmas Day or Diwali or something like that. There are important symptoms. We should seek care during that time. It will be unfortunate if it happens during a festive season like that. We might have to wait a little bit longer. But there are some important symptoms that could potentially be life-threatening that can be addressed only in emergency. But there are other times, I also gave you a list of conditions where where it will not be useful, and if you fall in those conditions, then you should probably not come to the emergency during that time. But there are some things that we can do as a community, as a person, in order to avoid going to the emergency in the first place. Prevention is key. Our diet, calories, salt, and oil. We have to really watch what we are eating. We should probably try to get inspired from these people who go, even when it's minus 40 outside, do active work in order to keep themselves very active. Exercise, watch our body mass index. Probably a lot of prevention seminars have discussed about your height, your weight, and then creating a body mass index and trying to be as perfect as possible in order to avoid diseases. Family physicians. We should follow up with the family physicians, have annual checkups done, and if there are new symptoms at the earliest phase, we should probably seek some attention. Being organized. We should be organized. So it is as important as managing your finances, your bank accounts, and your work. Your health is quite important. If you get symptoms, be organized, get regular checkups, and as well as have an organized way of doing an exercise program so that we keep ourselves healthy. So when people with chronic symptoms come, we just tend to think of this analogy. Lack of planning from your part does not constitute an emergency on my part. Observing safe practices, so accidents do happen, but we try to make it as safe as possible when we are just having new machines that we are trying to work with without reading the instructions, or trying to cut our onions too quickly and then losing part of our fingers, and safe driving depending upon the conditions. So we use some common sense, for the most part, it will be good. We will be able to avoid a lot of things. So the next portion is where people come to us with certain symptoms. They are pretty good in coming to the emergency for these symptoms. But there has been a lack of advanced planning. When we are able to plan it ourselves, we should probably think through the process of what we should do. Ethnic communities, particularly we as South Asians, really poorly lack in this planning. And we find that it is people of our ethnic origin having a lot of difficulty in emergency in a very vulnerable stage, having a lot of difficulty because this process has not been thought through. So, as I said, not only just making yourself healthy and preventing the emergency visits, this is an integral part of our life. It's exactly similar to our finances, it's similar to our will, similar to our estate, funeral arrangements, taking care of our kids, as equally important in deciding what should happen or what kind of care we should get when we are not able to express wishes ourselves. So when you are capable, you should express your wishes to a person who is very trustworthy. This trustworthy person is called the power of attorney or a substitute decision maker. In fact, you should have a substitute decision maker for every aspect of your life. Your finances, if you are a middle-aged person and if you have like younger kids, who's going to take care of your kids in the future? And also for your health. There has to be somebody whom you designate as a substitute decision maker in order to take care of your healthcare decisions. We'll go through why this is important. So you will have to decide about your personal care. If I am not able to take care of myself, what kind of care do I need and where do I need it? Is it in a retirement home or is it in a nursing home that I need care? And what type of care will I need? And you will have to assess yourself what kind of support systems that you have. You have two children, one is in Vancouver, other one is in the US, you've got nobody here. You have to think about the fact that your children probably will not be able to come and take care of you full time. There may be situations where you are in the borderline and you're slowly declining and you will need some help in the form of some support as to where you're going to live because you cannot take care of the home yourselves anymore. You will need somebody to do the groceries for you because you're not able to drive anymore, and somebody to cook for you, somebody to help you bathe because you have some difficulty and you're falling repeatedly in the bathroom. This is the common thing that I find people of our ethnic origin have not planned at all. They're languishing in the emergency department, they're languishing in the hospital bed because the emergency department and the hospital beds are not the places who can provide the best care. I'm just going to provide you emergency treatment and that is where I'm going to stop. But you're going to be lying around there because you don't have a place to go anywhere else. That is when we have to decide ahead of time if such a thing were to happen, how are we going to deal with it? A best example is my father-in-law who recently had a massive stroke. Okay. So luckily he was here in the United States and my my wife, his daughter and the son are able to take care of him when they brought him home. There is 4 personal care aides who are 24/7 taking care of him. Okay. So if he was alone or if he was not able to do it himself, even if he had money, he would not have been able to just organize this process together. And an example of things are because he's going to be happy, we brought him home to his son's place in Detroit. Okay. An example of the expenses is that home care for him would cost $1,500 per day if he was in a retirement home or a nursing home with help required. So the average cost of a retirement home or a nursing home ranges somewhere between $1,500 to about $4,000. If you go on Hunt Club, there is a really posh, I think it's Windsor Manor, you got to pay $5,000 to go there. It's like beautiful, like a hotel. And the cost of home care is going to be more than, at the peak time, your expenditure per month. And we like to communicate during that time when we are doing those wishes as to how we would like to take care of ourselves. So we want it to be preferably a religious environment where we can go to a temple about once a week, or listen to some bhajans, or observe some things, because you are not able to express at that time anymore. So you have to express these things, what are important to you. And if there is no point in the form of you're not going to get better, what should your children or what should this power of attorney do? You're connected to life support. You have big bleeding in the brain. It's not going to improve. You're going to be vegetative. In those circumstances, what should the power of attorney do? Should they keep you alive continuously, or should they let you go in peace? those kind of discussions need to happen, and due to some religious or ethnic backgrounds, we are not having these conversations. And what's happening is that our seniors are having these kind of problems or conditions in the emergency department. I'm seeing them. I have one daughter who says, do everything. I have a son who says, no, he has to be peaceful. And we are just involved in these discussions at that moment because nobody knows what dad or mom really want. Personal care services, like what kind of personal care services would you like? Like, would you like to be dressed like an Indian all the time? Or you do not prefer the person of opposite sex to touch you because you have certain beliefs and things in it? And when they are feeding you, you would rather have some Indian food. Example, once again, my father-in-law, he was in the hospital and he would not eat anything. The speech language pathologist came in and said that, oh, I think his swallowing is completely gone. So, we bring him home, we start feeding him some Indian food, he started swallowing immediately. So, those kinds of things. Because from their experience, they will know that they are not probably going to eat plant food anymore. Food, clothing, we talked about, and safety. Safety issues are also important. You should communicate that the moment that this power of attorney or your son or daughter, that the moment that you feel that I am unsafe, you should help me to organize certain things. This document, you can either do it by video, audio, or face-to-face with this power of attorney. Usually going to be your family member. You can get some help from your doctor, lawyer, friends who've gone through this process. This is a legally binding interaction that you have. If your son, daughter, or this power of attorney person does not follow your wishes, they can be penalized by law for this. It can be changed at any time. Like, you feel that, okay, you have a minor stroke and then you did something, things completely improved, you're feeling a lot better, you can go back and change your wishes. And think about organ donation. And if you don't have the document as to who is going to make decisions, these are the list of people who are going to make the decisions for you. And at the end, you can just see a public guardian or trustee is going to make the decisions for you. You really don't want that to happen. So think about your values and wishes, consult with the people, think of the person whom you trust and nominate them as the substitute decision maker. Have the discussion with the substitute decision maker, and as well as everybody in the family, your rest of the other children who are close to you, because there is no controversies in the future. You can change it at any time. It can be as a tape, it can be written, and you can also put it as a small little wallet card in your wallet with the number of the person who is the substitute decision maker, so that if you come to the emergency or any place where you cannot be able to speak, the first thing that we do is open your wallet to check your identity. We'll have this wallet card, and there will be a substitute decision maker. We will call the substitute decision maker to decide what should be done and what should not be done. And I'll stop there.
But it was an excellent overview. We have lots of personal experiences to go to emergency. I'll come back to that. But before that, any questions?
You mentioned chest pain. Chest pain can also be indigestion. Okay, so when one is having a chest pain, how does one distinguish? Is it a serious issue or is it just a very?
That's a puzzle for ourselves and cardiologists too. The best advice that I give to you is that there are some features that help you. If it is new, if you have cholesterol, high blood pressure, diabetes, and I think it's must that you should see an emergency person to decide what is probably going on. We are not accurate, but we can at least try to differentiate whether there is a heart attack that is happening at the present time with blood tests and ECG.
with your story, we can try to construct what is the probability of it coming from the heart versus indigestion. If it is new, you should seek medical care. If you have had this several times and all the time you go to the emergency and we do the test and it is negative, and you have gone and seen a specialist, everything has been worked out and your heart has been fairly clear, you get the same symptoms without any changes. You eat, for example, spicy food and then you get this, then your own going through the process, you can just say everything looks the same, it's very unlikely. But when it is new, it is very difficult for us and the cardiologists to differentiate, so do not try to differentiate yourself.
None?
You mentioned your father-in-law's situation in hospital where he could not swallow because he didn't like the food. Do the Ottawa hospitals have arrangements for ethnic food for people who would not take regular food served in the hospital?
No, they cannot prepare Indian food, but they will not prevent you from bringing your own food there and feeding the patient. So you can bring your own food.
Shiv?
What does a patient do with symptoms of motor paralysis and the hospital keeps sending you back 4 times over a week?
So usually when you come in and when we assess you, if we are worried, we will consult a neurologist. Okay. If there is a treatment that is available for which you need to be admitted, and if we admit you, if it is going to make you better, because we are going to either give you treatment or you are not able to take care of yourself at home, then there is usefulness in admission.
The condition would be the symptom the doctor sees, that the blood sodium is low, but they say they don't want to treat because if they treat, then they have to admit the patient, but they don't have room.
I am not really sure what the situation is. For most of us in the emergency, whether there is a room in the inn or not does not decide whether the patient needs to be admitted or not. We make the decision to admit. You might be, the patient may be in the emergency for 3 days, 4 days, but we do not bother about that because we think that the patient requires admission, the patient requires admission. It does not matter whether there is room in the inn or not.
Let me answer this. You're talking about hyponatremia.
Yeah, hyponatremia.
What was the sodium level?
Yes.
What was it?
Eventually it's developed into Guillain-Barré
No,
syndrome.
what was the sodium level?
Oh, I don't remember. It was way below.
No, let me answer it.
Yeah, because I don't have the value.
No, but I can answer it very precisely. Sodium level, if it has to come down, is it slow? It is fast. If it is slow, developing over a month, sodium level is 140, it comes down to 125. We don't worry. Because
It
there
can be
are
corrected slowly.
there are no symptoms, usually. But if the same person, sodium is 140, comes down to 120 in 1 day, the whole equilibrium between the cell and the blood volume shifts. So they develop shift of water into the cell and they swell up. That's an emergency. Nobody will ever send that patient home. I can assure you. I have seen, well, exceptions are always there. I'm not saying, because I have seen this hyponatremia, probably hundreds of cases through my kidney practice. And these are simple, straightforward rules, that if it's a sudden drop in sodium, you will have to treat as an emergency. There are exceptions, Nirmala, always. We are not saying that emergency is perfect. I think these things happen.
Yeah,
Any
so I completely concur with Dr. Jindal that he actually quoted nicely the 120 number right over there. So above 120, mostly what is going to happen is that we are going to give some IV fluids in the emergency and so I'm going to send you home. Below 120, when Dr. Jindal talked about the cells, one of the important complications is seizure. We tend to admit those patients with sudden severe below 120 and admit them.
All I'm saying is, with that, there is motor paralysis developing, and hyponatremia is only an indication, but there is a physical thing that is happening, and that the hospital says.
In general, the hyponatremia does not, except for the seizure, it does not give rise to certain neurological symptoms.
Yes.
And if it is Guillain-Barré, it's one of the toughest diagnoses to make. Somebody has to go through all through the process, and then when they're observing over time, then you make a diagnosis. It can be quite difficult.
Actually, Guillain-Barré can lead to low sodium. It's part of the syndrome.
Yeah.
It's called syndrome of inappropriate antidiabetic hormone. It's part of it. Any other question? Yes, please.
How will, sorry.
I'll come back.
You mentioned about clot buster. So when if a person comes to the emergency and stroke is likely, you administer that right away or only after all the CT, MRI scans?
Yeah, so that's a good question. You come in and if the patient has got certain set of symptoms where a clot buster would be beneficial and the stroke symptoms are there, we call something as a code stroke. The CT scan, the scan of whoever is the patient there, who just takes like 2 or 3 minutes, that patient will be completed who's on the table in the CT scanner machine, and the CT scanner is made vacant for this patient to come in immediately. The patient goes there, and the neurology team and the emergency team looks at your CT scan, make sure that there is no bleeding. Sometimes we can rarely see the clots, and then it's immediately done. So they call as door to needle time, which is the time that you enter the door of the emergency to the time I started giving the clot buster. It's usually about 20 minutes.
Actually,
No, I think I didn't understand if the sodium drops. What are the symptoms? Maybe you might have said.
okay, okay. It's a very common thing. It's not something rare.
Mhm.
People have high blood pressure. People are on water pill as a treatment for high blood pressure. It's a very common practice. If you look at their sodium level, it could be in the 125 to 130 range.
No, but how a ordinary person like me
That's what
know-
I'm coming to.
Okay.
That person will have no symptoms. That's what I'm trying to say.
Mm.
So you don't need to worry about it.
Mm.
If all of a sudden a person has weakness in the leg and also gets a little twitching, worst is convulsion. That's the extreme. So if you go to the emergency, they do all kind of things. And if they find the sodium, if the sodium is 125, 130, this will not happen. The sodium will be 110, 115. So from 140 to 115, it has dropped in a short time, and the water shift has taken place. Your cells are swollen inside, and that leads to twitching, convulsions, and so on. Now the treatment for that is very fundamental. Don't ever give normal saline. The
Salt
bottles
solution.
that they give you intravenous, there are different types. So you have to give a very concentrated sodium, small amount, so that you bring the level from 115 to 125 and the water shifts from the cell, your symptoms will be better. But for ordinary situations, it's not a serious concern. That's what I'm trying to say.
And another time that this happens is that you go to the family doctor says reduce your salt intake, and there is absolutely no salt intake, and then you drink lots of water,
That's it.
and that causes an imbalance too. Okay, so as Dr. Jinder said, like it's fairly common until otherwise there are serious symptoms. We just don't need to jump in and treat. It usually happens over several hours, and similarly, the correction has to take over several hours.
I want to give you 4 examples which happened. 1 week ago, one of our priests developed vomiting, diarrhea, and could not even sit. He was so dizzy. And so they called, family doctor, they called me, and we talked about, and can we give a Gravol, can you drink ginger ale, things of that kind. So we gave it to him, and no, vomiting, and poor fellow couldn't even sit. He was so dizzy. Now what could have happened? The blood pressure can drop, obviously he's dehydrated, and if the blood pressure drops to that degree, and that's the point, the sodium also drops because he's vomiting and diarrhea. And so we said, let's call 911. So he went to the emergency. During the transit time from the temple to the emergency, the ambulance person says, are you sure you want to go to the emergency? So anyway, they went there. The triage nurse looked at him, probably took the blood pressure, and said, sit down in that corner. Oh, poor fellow sat there. Luckily, he was not vomiting anymore. 6 hours. 6 hours went by. So he called me. He said, I'm feeling much better. I said, wait a minute. You came all the way, now you want to leave because you have to wait? So he went to the stage came, he went to the doctor. Doctor saw him. He said, oh yes, you're cured, go. So he came back. These are some of the things we cannot make a decision about it. I think if we have waited, okay, you just lie down in bed, don't get up, and maybe 6 hours like this, after 6 hours you're fine. But as you said, in doubt, we couldn't help except sending to the vet.